There's one question that divides men, families, and even entire cultures. Are you truly better off with or without your foreskin? For decades, this debate has been ruled by tradition and taboo. But what if the latest science reveals answers most men never hear, answers that could impact your health, sexual performance, and even your cancer risk? Millions of men are living with hidden risks or missing out on potential benefits because of a decision made for them as babies or a choice they're now facing as adults. The truth? There's no universal answer. But knowing the facts could change everything for you or someone you care about. Today, I'll break down white heavy checkmark what your foreskin actually does and why it matters. White heavy checkmark the proven health benefits and real risks of circumcision. White heavy checkmark when surgery is truly necessary. And when it is a white heavy checkmark, what every man over 40 should know before making this decision. By the end, you'll have the clear, science backed facts to make the best choice for your health, confidence, and future. Let's begin with the basics. What exactly is the foreskin? In medical terms, it's called the prepuce, a retractable fold of skin that naturally covers the head of the penis, known as the glans. At birth, it's usually attached to the glans and gradually becomes retractable, most often by the time a boy reaches adolescence. But here's the important part, it's not just extra skin. The foreskin has several biological roles. Protection. It acts as a natural shield, covering one of the most sensitive areas of the body. It helps prevent constant friction from clothing and reduces exposure to irritants or bacteria. Moisture and lubrication. The inner surface of the foreskin helps maintain a balanced, moist environment around the glands. This natural lubrication can make sexual activity more comfortable. Sensation. The foreskin is full of fine-touch nerve endings, thousands of them. For many men, this extra sensitivity contributes to arousal and plays a real part in sexual pleasure. So while it may look simple, the foreskin actually serves important protective and sensory functions. Now, let's flip the coin and look at what science says about the potential benefits of removing the foreskin. With your hygiene. With the glands exposed, it's generally simpler to keep the penis clean. This helps prevent the buildup of smegma, a whitish substance made up of skin cells and oils. While smegma itself isn't harmful if washed away regularly, poor hygiene can allow it to accumulate, leading to odor, irritation, or infection. Lower risk of infections. The space under the foreskin can trap warmth and moisture, creating an environment where bacteria thrive. This can sometimes lead to balanopostitis, inflammation of both the glands and foreskin. Research also shows that circumcision in infants significantly reduces the risk of urinary tract infections, UTIs, during the first year of life. Reduced risk of some STIs. This is where the evidence is particularly strong. Large-scale clinical trials, including landmark studies published in major medical journals like The Lancet, demonstrated that circumcision lowers the risk of HIV transmission in heterosexual men by as much as 60%. The data also show decreased rates of HPV, the virus linked to cervical cancer in women and penile/throat cancers in men, as well as reduced transmission of herpes simplex virus type 2. The explanation? The inner foreskin is thin, delicate, and rich in immune cells that viruses target. Removing it reduces a major entry point for infection. That said, circumcision is not a replacement for safe sex. Condoms remain the most effective barrier against sexually transmitted infections. Lower risk of penile cancer. Though rare, penile cancer is often linked to chronic inflammation, HPV, and poor hygiene. Circumcision indirectly lowers this risk by improving cleanliness and reducing exposure to those risk factors. Of course, like any surgical procedure, circumcision isn't without its downsides. Let's look at the most important ones. It is still surgery. Even when done by a skilled professional in a sterile setting, there are always risks, though they are generally very low. These include pain during recovery, bleeding, or infection at the incision site. In rare cases, too much or too little skin may be removed, leading to cosmetic or functional concerns that might require corrective surgery. Changes in sensation. The foreskin is loaded with fine-touch nerve endings. Removing it inevitably alters the sensory experience of the penis. Once the glans is permanently exposed, it undergoes keratinization. The skin thickens slightly over time, which can reduce sensitivity for some men. Many circumcised men report fully satisfying sex lives with no issues. But others do notice a decrease in sensation and feel their sexual pleasure is different, sometimes diminished. It's a highly individual experience, but worth considering seriously. Loss of natural protection and lubrication. Without the foreskin, the glans is continuously exposed to friction from clothing. This constant contact is part of what leads to keratinization. The foreskin also naturally helps retain moisture, which is no longer the case after circumcision. So, while circumcision provides proven health benefits, it also comes with permanent changes that men need to weigh carefully before making a decision. So, after weighing the pros and cons, how do you know when circumcision isn't just a choice, but a medical recommendation? The most common situation is phimosis, when the foreskin is too tight to be pulled back over the glands. Mild cases can sometimes be managed, but severe phimosis makes hygiene difficult, increases the risk of infections, and can cause painful erections or discomfort during sex. Another urgent condition is paraphimosis. This happens when a tight foreskin is pulled back and then gets stuck behind the head of the penis. It acts almost like a tourniquet, cutting off circulation to the glands. This is considered a medical emergency and requires immediate treatment to prevent serious damage. Chronic or recurring infections, such as balanoposthitis, inflammation of both the glands and foreskin, are another reason doctors often recommend circumcision, especially if creams, improved hygiene, or other treatments fail to solve the problem. In these cases, surgery isn't about cultural choice or personal preference. It's the clear medical solution to restore comfort, prevent complications, and protect long term health. Here's the bottom line: this is your body, your health, and your decision. The foreskin isn't just extra skin, it plays real roles in protection, sensation, and natural lubrication. Circumcision, meanwhile, brings its own proven medical benefits, especially for reducing infection risks and simplifying hygiene. But it's a permanent change, and like any surgery, it comes with its own risks and consequences. There's no universal answer. What matters most is that you have real facts, not myths or pressure, so you can make the decision that's right for you. If you're dealing with pain, tightness, recurring infections, or anything that doesn't feel right, don't just hope it'll go away. Don't let embarrassment or uncertainty keep you from getting help. Reach out to a qualified urologist who can give you a real diagnosis and advice tailored to your situation. No video or forum can replace that. Don't risk your help on rumors or what others expect. Get real answers from real experts. Now, I want to hear from you in the comments below. What questions about men's health do you wish more doctors would answer honestly? Are there topics that feel too taboo to discuss, even though they shouldn't be? Or maybe you have your own experience with this issue. What advice would you give to other men facing the same choice? Your comments help break the stigma, support other viewers, and shape future videos on this channel. Let's make this a space where men can actually talk about what matters. If this video helped clarify something you've been wondering about, let me know. Sometimes knowing you're not alone is exactly what another man needs to hear. Hit like if you found this breakdown valuable, subscribe for more honest, science-based content, and share this video if you know someone who could benefit from a balanced perspective. Your help is your most valuable asset. Make your choices confidently and never settle for less than the truth. I'm Dr. Elizabeth Rains. Take care of yourself because no one else can do it for you.